Hello, welcome to Telenursing EU project. I will be your virtual tutor. Let's explore Module 3 about patient assessment situation through telecare. Let's start with the general aim of this course. Nurses, physicians, and advanced practice clinicians who practice telecare must consider the components required to complete an effective patient-assisted remote assessment and plan ahead based on their specialty area and the patient's presenting complaint. The aim of Module 3 is to provide specialized knowledge about the principles that are fundamental for the effective assessment of the patients through telecare. Objective is to provide the main principles and strategies that nurses need to know and to apply in order to effectively assess patients' health status through telecare. Let's see the objectives of Course 3. The first is Basic Principles for Effective Assessment of Patients via Telecare. The second is Fundamentals of Nursing Assessment. The third is Guidelines for a Patient-Assisted Virtual Physical Examination. The fourth is Remote Monitoring of Patients' Vital Signs. The first sector of this lesson focuses on the basic principles for effective assessment of patients via telecare. The main principles that nurses need to know and to apply in order to effectively assess patients' health status through telecare are: patient selection. Due to the limitations of patient-assisted assessment, carefully consider which clinical conditions are suitable for visits that include a patient-assisted assessment component. For visit preparation. The patient becomes an important partner in the physical assessment process during a telehealth visit. Visit initiation. Introduce yourself and confirm the patient's identity with 2 identifiers. Evaluate how the patient looks to help determine if the telehealth visit is appropriate. Let's discover the strategies to address distracted patients. 1. Set technology expectations for telehealth visits. 2. Set behavioral expectations for telehealth visits. 3. Assess the patient's environment at the initiation of the visit and respond accordingly. 4. Document the interventions taken to address patient distraction. Continue to Lesson 3.2 Fundamentals of Nursing Assessment. The purpose of nursing assessment is to establish a database concerning a patient's physical, psychosocial, and emotional health in order to identify health-promoting behaviors as well as actual and potential health problems. Through assessment, the nurse determines the patient's functional abilities in the absence or presence of dysfunction. The assessment phase also offers an opportunity for the nurse to form a therapeutic interpersonal relationship with the patient. During assessment, the patient is provided an opportunity to discuss health care concerns and goals with the nurse. The essential elements of the assessment process are data collection, data verification, data organization, data interpretation, data documentation. Assessment, like all other phases of the nursing process, is patient-centered. Let us see the types of nursing assessment. The type and scope of information needed for assessment are usually determined by the healthcare setting and needs of the patient. Let's talk about 3 important types of assessments: 1. The comprehensive, 2. The focused, and 3. The ongoing assessment. Comprehensive is usually performed upon the first appointment to a healthcare agency and includes a complete health history to determine current needs of the patient. Focused is an assessment that is limited in scope in order to focus on a particular need or healthcare problem or potential healthcare risks. Ongoing assessment is an assessment that includes systematic monitoring and observation related to specific problems. Now let's explore methods of data collection. Observation. The nurse uses the skill of observation to carefully and attentively note the general appearance and behavior of the patient. Interview. An interview is a therapeutic interaction that has a specific purpose. The nurse interviews for a variety of reasons throughout the nurse-patient relationship, including data collection, teaching, exploration of the patient's feelings or concerns, and provision of support. Health history. Nursing health history focuses on the patient's functional health patterns, responses to changes in health status. Physical examination. The purpose of the physical examination is to make observations of any deviations from normal and to validate subjective data gathered through the interview. Let's go to Lesson 3.3 Guidelines for a Patient-Assisted Virtual Physical Examination. Telecare allows nurses to deliver a wide range of services conveniently and efficiently. It is important to develop the right processes for virtual physical exams. This is achieved by following the below. Before the exam begins, Help patients and caregivers feel at ease and focused on their care by addressing any potential technical issues. Ask if they can see and hear you. If not, ask them to refresh their web browser. During the exam, as a healthcare provider, it is most important to pay attention to what you see and hear during a virtual physical exam. Ask patients thoughtful questions. Encourage them to clearly describe how they're feeling and their health history. Pay special attention to their responses, tone of their voice, and body language. Engage with them by nodding and responding in small ways. After the exam, ask the patient if they have a pen and paper to write down any important takeaways from the exam. Let them know that an electronic message with instructions on when to follow up will be sent after you disconnect. In this figure, you can see the 10-step checklist for a patient-assisted physical examination. Let's talk about these steps. Step 1. Vital signs. Patients need to check about weight, blood pressure, pulse, oxygen, and temperature. The patient can be guided through these measurements by a medical assistant or nurse prior to the virtual visit. Step 2. Skin. Check for new brushes, rash, swelling. Step 3. Head, eyes, ears, nose, and throat. Ask about hearing. Ask if vision or sense of smell is acceptable or has changed. Step 4. Neck. Ask if they note a bounding pulsation in the neck. Step 5. Lungs. Ask patients to deeply inhale and exhale through an open mouth. Listen for cough or wheezes. Step 6. Heart. Ask if the patient or caregiver can take the pulse at the wrist. Have them count out the beats they feel. Step 7. Abdomen. Ask patients if their abdomen is soft, non-tender, and normal in size. Step 8. Extremities. Ask if patients' hands or feet are colder than usual, or just the fingertips and toes. Step 9. Neurological. Ask patients to hold their arms out with elbows straight, spread their fingers, and turn their hands up as if catching rain. Ask patients if they have noticed a tremor. Step 10. Social determinants of health. Inquire about issues regarding changes in diet, physical activity, sleep, stress, and social support. Let's go to Lesson 3.4. Remote monitoring of patients' vital signs. Vital signs are an objective measurement of the essential physiological functions of a living organism. They have the name vital as their measurement and assessment is the critical first step for any clinical evaluation. The first set of clinical examinations is an evaluation of the vital signs of the patient. Triage of patients in an urgent prompt care or an emergency department is based on their vital signs as it tells the physician the degree of derangement that is happening from the baseline. Healthcare providers must understand the various physiologic and pathologic processes affecting these sets of measurements and their proper interpretation. If we use a triage method where we select patients without determining their vital signs, it may not give us a reflection of the urgency of the patient's presentation. The degree of vital sign abnormalities may also predict the long-term patient health outcomes. Return emergency department visits, and frequency of readmission to hospitals, and utilization of healthcare resources. Let's analyze the vital signs. Temperature. Body temperature is a variable, which is complex as well as nonlinear, and is affected by many sources of internal and external variables. The normal body temperature for a healthy adult is approximately 98.6 degrees Fahrenheit or 37 degrees centigrade. Pulse rate. The most common sites of measuring the peripheral pulses are the radial pulse, ulnar pulse, brachial pulse in the upper extremity, and the posterior tibialis or the dorsalis pedis pulse, as well as the femoral pulse in the lower extremity. Respiratory rate. The respiratory rate is the number of breaths per minute. The normal breathing rate is about 12 to 20 breaths per minute in an average adult. In the pediatric age group, it is defined by the particular age group. Parameters important here again include rate, depth of breathing, and pattern of breathing. Blood pressure. Blood pressure is an essential vital sign to comprehend the hemodynamic condition of the patient. Unfortunately, though, there are a lot of inter-person variabilities when measuring it. Many times, the basic measurement techniques are not followed and lead to erroneous results. Let's see how monitoring patient vitals with remote patient monitoring (RPM) works. Remote patient monitoring, also known as RPM, is a method of healthcare delivery that collects patient data outside of traditional healthcare settings using advances in information technology. As part of an RPM program, A patient's vital signs such as blood pressure, heart rate, respiration rate, oxygen saturation level, and temperature are remotely monitored using digital tools and devices. Let's dive deeper into the 5 key benefits of remote vitals monitoring: increased access to value-based care, improved patient outcomes, healthcare cost savings, enhanced patient engagement, increased healthcare provider efficiency. Now you can see how remote patient monitoring works in 5 steps. The provider or organization decides to deploy remote patient monitoring to monitor their patients. One providers use remote patient monitoring for a variety of conditions to collect a wide range of patient data. Common devices include blood pressure cuffs, pulse oximeters, thermometers, glucometers, weighing scales, ECG stethoscopes, activity trackers, spirometers, and more. 2. With the patient's consent, the provider deploys remote patient monitoring into the patient's home or pocket. 3. The patient is provided with the necessary devices to collect their health data and offered education to help them understand how to use the technology. 4. Once the device is set up, at home or work, or even on the go, patients monitor their vitals to collect their health data. Patients can record their vitals once a day or more frequently, depending on their condition and provider's direction. 5. In real time, the reading from the biometric device is sent to the patient's provider, where the provider can then monitor trends and changes. When a reading is out of range, the provider is notified with risk alerts, helping the provider be proactive in their response. You can see the top benefits of remote patient monitoring right here. 1. Improved data-driven clinical decision-making. 2. Helps patient improve self-management and care plan adherence. 3. Cost of care reduction for payers and providers. 4. Boosts net patient revenue. 5. Reduces patients' expenses and improved work productivity. 6. Improves access to care. 7. Builds patient engagement. 8. Optimizes clinical staff efficiency and combats clinical staff shortages. 9. Prevents the spread of infectious diseases and hospital-acquired infections. 10. Improves patient experience and satisfaction. 11. Expands referral opportunities and improves retention. 12. Improves the clinician-patient relationship.